Thank you. Thank you, Prime Minister. Today I am delivering on an ACT National Coalition agreement to reform New Zealand's health and safety laws and regulations. Last year, I travelled the country from Whangarei to Bluff, hearing directly from businesses, employers, workers and iwi about their experiences with the health and safety system. I had the privilege of talking to everyone, from farmers to tradies to road workers. There were a number of themes that came out of the roadshows and from public consultation, including that there is a lack of guidance on what is considered reasonably practicable and therefore what is needed to be deemed compliant. Some regulations are overly complex and out of date, and the pace of change has been slow. There is a fear of WorkSafe arising from difficult engagements or inconsistent treatment, and New Zealanders really hate road cones. I heard that while larger businesses may be able to afford to hire dedicated health and safety professionals, small businesses in particular can struggle to get the information they need to ensure they are compliant and can also struggle with the costs of compliance. I also heard concerns that the scope of workplace health and safety obligations is creeping into unintended areas of life, from the proliferation of road cones to Santa parades. This is having a chilling effect on activities many would consider part of the Kiwi way of life. Today I am pleased to announce the first tranche of the health and safety reforms Cabinet has agreed to. Today, workers can be assured that their employers will prioritise the right actions to protect them from harm, and they know where their attention should be to keep themselves and their workmates safe. One of the first changes will be a carve-out for small, low-risk businesses from General Health and Safety at Work Act requirements. Health and safety obligations from these businesses will be limited to providing basic workplace facilities and only managing critical risk, such as risks that cause death or serious injury or illness. I know the struggle small businesses face in dealing with red tape and regulations, and this change will help them focus on what matters most. Under this change, for example, a small retail clothing shop would need only to meet minimum duties relating to first aid, emergency plans, and basic workplace facilities, but would not need to have a psychosocial workplace harm plan or policy, or need to warn staff to be careful when steaming garments. Another change Cabinet has agreed to is to make critical risk the primary purpose of the Health and Safety at Work Act. This will reduce tick box health and safety activities that do not protect workers from harm and give workers assurance that their workplaces are prioritising the right actions to protect them from workplace harm. The reforms will also clarify the boundaries between the Health and Safety at Work Act and regulatory systems that already manage the same risks. These boundary issues have long been a source of over-compliance and confusion. For example, if a seismic risk assessment finds a school building meets the Building Act requirements, the school board should not think that the Health and Safety at Work Act requires them to close the building on seismic safety grounds. And finally, these health and safety reforms could not be complete unless we do something about the road cones. I've travelled across the country to hear health and safety concerns, and at nearly every meeting someone raised the issue of a sea of road cones. My colleague, Minister Bishop, is overseeing the NZTA side, which involves bedding in the new temporary traffic management guide to achieve a more efficient and risk-based approach. On the WorkSafe side, I'm going to direct WorkSafe to confirm and provide guidance on instances of road cone over-compliance. There will be a hotline for the public to report on excessive road cone use they might find out in the wild. Having WorkSafe focus on this will be a culture shift for the agency, but it signifies the broader direction this government is taking with the health and safety system. This is just the start of the reform program. I'll be seeking Cabinet decisions on further issues in the coming months, which will include improvements to WorkSafe and to address sector-specific pain points. Today, what I've announced means less time, less money, and less confusion around health and safety at work.